So I would like to warmly welcome you all to the CONROD Symposium 2015 and especially acknowledge the attendance of the Honourable Mark Bailey, Minister for Main Roads, Road Safety, Ports, Minister for Energy and Water Supply, Mr Neil Singleton, Commissioner, Motor Accidents Insurance Commission, our keynote speakers, Professor Tim Geraghty from Princess Alexandra Hospital and Professor Grahame Simpson from Liverpool Hospital, Sydney, our new Professor and Chair of Rehabilitation Research, Professor Michelle Foster, and our University Executive, Professor Leslie Chenoweth, Pro-Vice-Chancellor and Head Logan Campus, Griffith University, Professor Bruce Abernathy, Executive Dean, Faculty of Health and Behavioural Sciences, the University of Queensland, our CONROD Executive, Interim Director, Emeritus Professor Gwendolyn Jull, the University of Queensland, who cannot be here with us today. She's in Chile, I understand. And CONROD Deputy Directors, Professor Justin Canardi, the University of Queensland, and Professor Michelle Sterling, Griffith University, and our Griffith University Research Director, Professor Elizabeth Kendall, and our presenters. Welcome to everybody. And you as our important audience. This day brings together health professionals, policymakers, researchers, academics, service users and service providers across government, non-government, not-for-profit and community sectors for the purpose of sharing knowledge and insights relating to catastrophic injury and most particularly brain injury. CONROD is the leading recovery research centre in Queensland and represents a long-term joint partnership between the University of Queensland and Griffith University and is supported by the Motor Accidents Insurance Commission. For 20 years we have conducted groundbreaking research into healthcare systems, evidence-based treatment approaches, promoted individual capacity and self-determination and facilitated more positive outcomes for injury survivors. Today, we present some leading initiatives in this field, the current research, as well as discuss the complex issues facing the catastrophic injury sector in 2015. And there are a few. I hope you find the day informative and inspiring and leaving you with many more questions than when you first arrived. And with that, I would like to welcome the Honourable Mark Bailey MP to the stage to officially open the CONROD Seminar 2015.
I'd like to respectfully acknowledge the traditional owners on the land on which we gather, the Yagara and the Turrbal people, and pay my respects to elders past and present of a culture that goes back 60,000 years on the land on which we gather. I'd also like to acknowledge Professor Heidi Muenchberger, CONROD Associate Director, Professor Leslie Chenoweth, AO, the Pro-Vice-Chancellor and Head of the Griffith University Logan Campus, Professor Bruce Abernathy, the Executive Dean of the Faculty of Health and Behavioural Science, University of Queensland, Professor Tim Geraghty from the PA Hospital, who I was just having a chat with, the members of the CONROD panel and committee, distinguished colleagues, ladies and gentlemen, welcome, and I'd like to thank you for your work in this very important area. During the time we spend together today at this seminar, 20 people in Queensland are going to be seriously injured in a road crash. Over the course of 1 year, this translates to about 7,000 people in Queensland, which is more than the population of Gatton. Since becoming the Minister for Road Safety, I've learned many things. I've learnt that if we're serious about a vision of zero deaths and serious injuries, everyone needs to be part of the solution. I've learnt that we need to be more ambitious when we formulate our targets. And that we need to see road trauma as a serious public health and social issue. We're all aware that the total economic, social and emotional costs of road trauma are enduring and enormous. Eliminating death and debilitating injury on the road is not just an issue of compassion and humanity, but it's also an economic one of investment that makes economic sense. In 2014, the economic cost of fatalities and hospitalisations as a result of road crashes in Queensland is estimated at more than $5 billion. Individual costs of medical care, lost productivity and diminished quality of life are also high. Across Australia, the lifetime costs per case of moderate and severe traumatic brain injury have been estimated at between $2.5 and $4.8 million respectively. Paraplegia and quadriplegia at $5 million and $9.5 million respectively per case. This is the economic cost of the human toll of road trauma that often isn't publicised. Some of you may recall that I met with experts at a forum we called after our worst Easter road toll in Queensland in more than 20 years to discuss what we could do about that. We looked at the particular issues we needed to address, and we looked at what can be done both right now and into the future to protect people from harm on our roads. And we gathered specialists in the road safety area, not just from Queensland but from across the country. It's a very useful discussion, needless to say, and it was very inspiring to see the passion, that knowledge base, the commitment of everybody wanting to advance policy and to make sure that we can continue to improve road safety. What certainly gives me hope is that we all share a vision to reduce road trauma in Queensland and that we're willing to work together to make those positive changes for the community. The recent release of the Palaszczuk government's road safety strategy and the 2-year road safety action plan is a clear statement that our government is committed to reducing road trauma. And in that light, it's a formal part of my title, of course, to be the Minister for Road Safety, something that is the first time that's occurred in Queensland. I think that gives you some sense of the priority that the Premier and this government places on the issue. The strategy and the action plan prioritises a number of areas: research, data and innovation, education and engagement, investing in a protective road environment, technology, enforcement, and also governance and strategy. We need to attack this issue from a wide variety of different directions. One of the guiding principles of this strategy is the true road toll is broader, of course, than just fatalities. Traditionally, there's been a strong focus on fatalities in the media on road safety, and these have attracted a lot of public attention. However, fatality data represents an incomplete and a much smaller picture of what the impact of road trauma. I believe we can achieve more by giving greater attention to hospitalised casualties. Hospitalised casualties are growing in number compared to a decreasing trend in fatalities. Last year was our lowest level of fatalities in Queensland in 45 to 50 years. But the cost to the economy and the far-reaching consequences for the people and families involved has increased substantially generally. Progress in addressing road trauma will only be made once combined efforts and attention is refocused on all serious casualties. So today, one of the themes I'd like to touch on is the importance of road trauma research and the role it plays in making death and serious injury a thing of the past. Through research, we're able to make smarter and more informed decisions from a government point of view. The quality of our research will determine the success of our initiatives. In other words, achieving our road trauma vision of zero starts with the great work being undertaken by institutions such as CONROD. A particular opportunity at the moment is to improve the data we use to track serious injuries, which is not as complete as we would like it to be. Better knowledge about when, where and why injuries occur and how severe they are will help us to develop more targeted interventions to reduce road trauma. To this end, we've made 2 commitments to the Queensland's Road Safety Action Plan, which will be of particular interest to you. Firstly, to convene an expert panel to better understand serious injury data and targeted initiatives to reduce hospitalisation casualties. And secondly, to develop options to improve collection and access to injury and incident data relating to bicycle riding. And I can speak from personal experience on this. I occasionally get inquiries from cyclists who wonder about our helmet laws, and I'm always absolutely categorical about that. I was car doored when I was 15 on a major road. And I'm around because I had a helmet on. And so as Minister for Road Safety, they get a considered but firm point of view on that one. These commitments sit alongside 55 other initiatives totalling more than $500 million over 2 years, all designed to improve safety, reduce injury and curb our road toll. Importantly, we remain committed to the safe system approach, which rejects the notion that death and serious injury are an inevitable part of using a road by ensuring that road users are not harshly punished for their mistakes. That is, that human error should not result in serious injury or death. The Productivity Commission estimates of the 1,000 people seriously injured every year in Australia, most are young men under 30, and 50% of these injuries are caused by road crashes. And when we had our forum in April after the Easter road toll, towards the end of the session, someone made a very salient point. We had a fantastic room of experts and specialists, and someone said to me and the chair, where are the young people in this room, and where is the strategy to deal with young people? Young people make up 34% of fatalities. They make up about 14% of drivers. It was an extraordinarily poignant point, and one that we acted on in light of that. So we're encouraging young people to become more involved in road safety solutions, given that they are so overrepresented. We recently invited 100 young people from across Queensland to what we called CoLab, to start brainstorming the road safety issues affecting their generation and to find ways of communicating and engaging with young people that are relevant to their culture of the time. I was very inspired. I made sure I spent a bit of time there actually, and just I was a bit of a fly on the wall to hear what was going on, and I was very inspired and impressed by the level of engagement and the level of commitment and ideas coming out of those people. And we made sure we had plenty of regional young Queenslanders involved on that day as well. They discussed challenges they experienced on the road, ranging from driver distractions and the temptation to use their mobiles, to drink and drug driving and peer pressure, obviously important issues when it comes to young people. Although initiatives like the graduated licensing systems have been very successful, young drivers are still, of course, more likely to be injured than more experienced drivers. The follow-up next CoLab event will be held in 2 days, on the 30th of September, where we can turn our minds to innovative solutions in partnership with the young people in Queensland. In this mode, we've already reformed the learner driver practical driving test in Queensland from June 29th of this year. It is a much more skills-based test in terms of getting your licence. We know that the risk dramatically increases once people go from a learner's to an open licence in terms of accidents, and we have a lot less emphasis on the old reverse parking and a lot more emphasis now on the high-risk manoeuvres that are actually the real risk for them. High-speed merging, turning across traffic, keeping distances from other vehicles, zero tolerance for speeding. If you speed on your learner practical test, you fail. We're very clear and we're hardline about it. And this much stronger test will mean better young drivers hitting the roads as of June 29 this year. We're also involving Queenslanders through a Citizens Task Force, which will be convened towards the end of this year to consider driver rewards and incentives. Hopefully you all saw the Perfect Ride motorcycle safety campaign for new and returning riders, including a television and social media campaign in June, which is being repeated again in October, as we're still finding this year there's been quite a spike in motorcycle deaths, sadly, in Queensland. We're also considering feedback following a motorcycle licensing discussion paper, which was out for public comment until September the 6th, and that we'll be responding to that in the near future. In response to the request to consider the dangers of mobile phone usage, which, up to 3 out of 4 drivers use their mobile phones at some point while they're driving, we've introduced double demerit points for repeated mobile phone offences committed within 1 year, similar to current arrangements for repeat seatbelt, motorcycle helmet and high-ranging speeding offences. Of course, you're here today as part of CONROD's commitment to inform policy and clinical practice by improving the health, psychological, social, vocational and economic outcomes of people with injuries and disabilities. Your work builds on the continuing work of the Department of Transport and Main Roads and local governments to undertake to make our roads safer through things like our black spot projects, our Safer Roads Sooner improvements, our safety mass actions and treating emerging crash locations. Through our dedicated road safety programs, we have applied innovative treatments, including 800 kilometres of wide centre line treatments on the state-controlled road networks and highways, which is terrific. Actually, I've seen them in action. It really separates traffic from, it's just such a simple idea. It's amazing we haven't thought about it earlier than now. We've delivered more than 260 road safety related infrastructure projects in 2014-15 alone, and we're committed to continuing these works through the funding of a $300 million targeted road safety program over the term of this new action plan. We certainly won't be stopping working to keep Queenslanders safe. We're also calling for a commitment from the community to drive safely and reduce the road toll. It really has to be a partnership with every driver on the road. We should all look forward to a future where death and serious injuries on our roads are a thing of the past. Serious crashes are preventable, and with a commitment from every single road user, this can in fact be a reality. So thank you all for your contributions in this very important area of public policy. I think this is an area, when you look at the outcomes over the last 40 years, it is a significant area of public policy success. You know, I remember as a 14-year-old, the road toll was 602 that year. The Courier Mail started to run a big campaign around it, and last year it was 223. So we're talking about fatalities. We've seen some successes in this field. It used to be about 31 fatalities per 100,000 drivers about 40 years ago. It's now down to about 4.8. But what we do know is while people are surviving, the level of trauma and hospitalisation still remains high and growing. And so that's an area that we really have to address. So thank you for your work in this very important area. I wish you well for the day's events and the collaboration going on here. A lot of knowledge in this room, and I do declare the proceedings officially open. Thank you for the invitation to be here.